If you have a $5,000 commercial deductible for your family, and you are a family with average healthcare needs, you never bust through your deductible. Somebody's got to get really sick. Something's got to happen. There's got to be an accident. So in almost any given year, you're buying all of your healthcare out of pocket.
The average family in the country is having $20,000 removed out of their paycheck to pay for their insurance premium while leaving them functionally uninsured.
I was running a benefits plan that didn't feel good. I didn't like it, right? Our employees certainly didn't like it.
Well, you get a $3,000 deductible and big copay. It's not really helping the average, employee making $35,000, $40,000 a year.
That's why cash wages haven't gone up very much, because it's been sucked up by insurance.
Employers assume frequently when they have a BUCA plan or a traditional healthcare plan in place that healthcare plan is taking care of their fiduciary duty. And that's absolutely wrong.
If I buy a $300 vacuum for our custodial staff, I have to get 3 quotes. But yet, the broker can put a piece of paper in front of us that says this narrow network or this narrow network, and then I'm going to pass that on to employees like I used to. And I'm going to sign away. I'm going to willingly sign away my ability to shop.
Why would we hand that over to someone else to advise us who's being paid by the very people who are being enriched through the system? We have to start bringing rational thinking to the economics of what's involved in healthcare.
I called them and I asked them for our data. Give me my data. They would not give it to me. They would not give me a thing. How much is this costing? What are you making off of this? They wouldn't give me a thing.
We've lost one of the key things that makes things better in the world, that loop, that feedback loop between seller and buyer.
You don't have to accept this system where things just go up and up and up.
So for 20 years, the head of human resources in that hospital would go back to their employees every year and say, our insurance rates went up 15%, and we're going to take 80%, and 20% of that's going to get passed on to you. And how much of that increase is getting passed on to your employees? 2 years in a row, they didn't have to say that one time to their employees for the first time in 20 years.
We've frozen premiums for 5 years doing these things.
These guys have no deductibles. You're going to see in a minute, they don't have deductibles in their plans.
The money saved pays for itself.
It cuts the cost for us in half, and the member doesn't have to pay anything.
We invested $250 grand and we had it back in 1 quarter.
Wow.
And that was when our eyes were opened.
Our employees are happier. The anxiety around healthcare is gone.
They do appreciate that.
You're holding in your hands the ability to fix healthcare, and I think we don't realize it.
If we can begin to understand the power there is in the hands of the ordinary CEO to bring change into the system.
The only weapon we really have, truthfully, is financial.
We're enhancing the benefits, and so that's what a lot of employers and consultants have put in for their clients is a better benefit plan at a lower cost.
We can vastly improve medical care in this country. We know we can slash costs. We know we can increase the amount and the availability of health care.
If you fix this industry, then the amount of resources that are freed up that are not now being stolen by the industry, it's transforming.
When the employers wake up and start demanding this, the dominoes will just start falling. They really will.
And the more people who are out there looking for it, the more hospitals are going to have to provide it, or someone else will.
The bottom line, your success is not only success for this industry, but also success for the United States of America. Thank you very much.